is the Emergency Medical Minute.
So my medical minute today is about using ketamine in patients with alcohol withdrawal. So Critical Care Medicine had an article that just came out very recently. It's a retrospective observational cohort study where they had a treatment arm of patients using just symptom-triggered benzodiazepines, and then another arm using symptom-triggered benzodiazepines plus a ketamine infusion of 0.15 to 0.3 milligrams per kilograms per hour until the delirium kind of resolved for the patients. It showed a significant decrease in rates of intubation in these patients, a decrease in the ICU stay, as well as a decrease in benzodiazepine use for these patients. So it's some pretty good results. More studies need to be out there, but it shows it's promising for using ketamine to decrease that benzodiazepine use and kind of get these alcohol withdrawal patients out of the hospital and back to being better. There was also an article in Journal of Medical Toxicology last year that looked at using ketamine for benzodiazepine-resistant patients. So patients with a lorazepam drip that hadn't been getting symptom relief at all, they tried ketamine and found that all the patients that they tried had symptom relief within an hour. And it also decreased the rate of lorazepam infusion later on. So ketamine might be a good option for patients with alcohol withdrawal, but there needs to be more studies too, of course.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.